Welcome to the interview. I'm Dan Hollander. Today we're talking with Lisa Hardison of the Lawrence County Health Department. Good to have you with us.
Thank you. Thank you for having me.
Obviously something that's in the news these days, and we'll touch on it as much as possible, and that's the Zika virus. Has it affected Lawrence County at all yet?
Well, no, it's not affected Lawrence County yet. There's been one case noted in Tennessee, but not in Lawrence County.
So that's good. And I'm sure people can go to where to find out more information about
They
it?
can go to the cdc.gov website, cdc.gov//Zika, Z-I-K-A.
Well, we're in the early stages of this, so I'm sure a lot more information will be forthcoming.
Sure.
Okay, good. Well, how about the flu? Let's talk about that. Has that caused some serious problems here yet?
Well, flu illness can vary from mild to severe, and there's every winter there's cases of flu. And while the flu can be serious even in people who are healthy, there is more problems with the younger children under the age of 2, adults over the age of 65, and those that have long-term health conditions, and those that might be in residents of long-term care facilities. And the Tennessee Department of Health has recently sent out a news release that the CDC has advised that there's been a rise in the reports of flu recently. And unlike last year, the flu vaccine for this year goes along with the strains that is causing illnesses. So that's a good thing.
Yeah, the flu shot is very valuable.
Yes, it is very valuable because the CDC does state that the single best way to protect yourself against the flu is to get vaccinated every year. So everyone 6 months and older should get the flu vaccine.
Mm-hmm. What age should you take a pneumonia shot, or should you?
Well, that's
Yeah.
Yes, okay. There are different types of pneumonia shots. There's actually 2 different types: pneumonia, the Pneumovax, and also Prevnar 13. The Prevnar 13 is recommended for all children from under the age of 5, and also for all adults 65 and older. Now, in between those ages, there are those people who might be at high risk for certain things that would benefit from getting the pneumonia vaccine or the Prevnar 13.
Mm-hmm.
And that could be things like people who have a low immune system, people who have cancer, leukemia, Hodgkin's disease, and things like that, or maybe an organ transplant. Now, the pneumonia vaccine, a lot of times we think about that for older people, but it's also important for younger people too in certain conditions. So the Pneumovax is recommended for all adults over the age of 65, and also for people aged 2 to 64 who do have certain conditions, and some of those conditions might be Hodgkin's disease, certain cancers, HIV or AIDS, a low immune system, you might have a damaged spleen, an organ transplant, and also if you might have be on medication that lowers your immune system, like long-term steroids, and any smoker that between the ages of 19 to 64.
So there are a lot of ifs and ands.
It is. It's best to talk to your healthcare provider.
I was
going to
say that would be a great idea. How about pneumonia? We're hearing some about that?
Yes, we always hear about pneumonia every year also, and pneumococcal disease is a disease that is spread from people who have the bacteria in their nose and throat when they cough or sneeze. So it is spread like that. And a lot of people, especially children, have this in their throat and nose and may not become sick from it. And this is known as being a carrier. So they don't know why so few carriers don't get sick, but some of them do. And a lot of times if it spreads outside of the nose to the ears or the lungs or places like that, then they can become sick. And those people who have a weakened immune system, like infants and young children and older people, can sometimes become more ill with that.
Viruses, we hear a lot about viruses, new ones and old ones. Any particular one or ones that we should be aware of?
Well, viruses, there are different ones, and colds and flu, of course, are the most common that you hear about this time of year. There's also those that cause intestinal problems. So you have to remember, too, there's a difference between viruses and bacteria. The viruses, normally, they don't require the antibiotics. They require antiviral treatment, and sometimes they run their course. And of course, bacterial infections may require antibiotics, and that's left to your healthcare provider also, treatment for that.
How about the community itself? Some ways that they can decrease the spread of germs? Got to be several ways.
Oh, there's lots of different ways. We've already talked about getting vaccinated every year for your flu vaccine, and your other vaccines too. Make sure that you're kept up to date with that. Also, good health habits. You want to avoid close contact with those people who are sick. If possible, if you are sick, stay home from work or school, or don't expose yourself to other people if you're sick. Cover your nose and your mouth with a tissue if you are coughing or sneezing. And one of the number one things you can do is good hand washing. That's kind of a do-it-yourself vaccine. And there's different steps, and there's always little songs you can sing, happy birthday, and that's how we teach our children sometimes, happy birthday, singing that, or twinkle twinkle little star. But remember that you need to wet your hands, you want to lather them, scrub them, rinse them, and then dry them really well. Because you can help prevent the spread of all sorts of diseases from just good hand washing. Also, avoid touching your eyes, your nose, and your mouth, because once you touch that, then you can spread it to the doorknobs and different things like that. And also clean and disinfect the areas that may be infected too.
Yeah. Are there such things as good germs as opposed to bad germs?
There are good germs and bad germs.
Oh, really? Let's find out about that.
Okay, there's good bacteria and bad bacteria. Our bodies are home to a lot of good bacteria. A lot of them reside in our gut, and that helps to make us healthy, and they live harmonious there with taking care of us. We have, certain bacteria on our skin that is normal. And so it becomes bad when we get too much of it, and it makes us sick.
Is it possible to avoid airborne disease?
Well, those diseases that I think you're talking about, such as the flu or colds or things like that, are spread through sneezing or coughing or talking. So we've just talked about some ways to avoid the spread of that. So you follow the CDC guidelines, and number one, first and foremost, is getting that flu vaccine every year.
Diet is important as well, isn't it?
It is. It's very important, not just for colds and flus and things like that, but for your good health also. It affects how you feel today, tomorrow, and also for your future, because it's part of a healthy lifestyle. Along with exercise, your diet can help you to reach and maintain your goals, reduce your risk of certain diseases like heart disease and cancer and diabetes and things like that. So it just promotes your overall health.
Yeah. If folks want some more information, should they contact your office or the health department in general?
That would be fine, yes.
And just ask the question, and
we'll be glad to talk with them.
Good. Appreciate it. That's the interview for today. We've been talking with Lisa Hardison, Lawrence County Health Department. Thanks for watching.